Hello, I'm Dr. Russ Dunkel, Wisconsin State Dental Director and Chief Dental Officer, and a member of the Wisconsin Dental Pain Protocol Advisory Group. Thank you for your commitment to addressing non-traumatic dental pain in your community. This section details the clinical resources and training necessary to assure that you can get patients out of pain, their dental infections under control, and into a dentist for definitive care. At the core of implementing the Wisconsin Dental Pain Protocol is the clinical algorithm. The clinical algorithm represents the current best practice in pain and infection control, as reviewed and recommended by a team of ED, urgent care center, and dental providers. However, best practice is also subject to the priorities and protocols of your own individual clinic or system. Therefore, the first step in training is to review the algorithm and modify it as needed to match your department or clinic's practice and protocol. Once that's done, this section provides guidance on seeing that the algorithm is used by all clinical staff. The resources in this section include information on training, supportive materials, administering local anesthetics, stocking and maintaining instruments and anesthetics, evaluating training sessions, and accessing technical assistance. As you review training materials and resources, it's essential that you rely on internal and local capacity as much as possible. If you have an oral surgery or dental program, engage them in reviewing the clinical algorithm and training the ED staff. If you have local dentists willing to be partners, build those relationships early. The success of the Wisconsin Dental Pain Protocol is in building institutional support, getting staff trained, and as important, maintaining clinical expertise into the future to ensure that every patient gets the best care available. Finally, what happens to a patient on discharge is the most important and difficult step in the Wisconsin Dental Pain Protocol. The patient needs to get the source of pain under control. If not, at least a quarter of the patients will end up back in the ED or urgent care centers within a month. It's bad for the patient, it's bad for your clinic, and it's bad for the community. Your discharge processes and ability to build strong ties to dental providers in your community are essential for your patients and you. And as always, thank you for your commitment to addressing dental pain and infection and reducing the burden of opioids in your community. As you build your clinical capacity, please feel free to call on the technical assistance and training resources identified in each section.